Hi everyone, I'm Dr. Z. I'm a clinical psychologist specializing in adult transgender care. Welcome to my channel. If you have not had a chance yet to subscribe, I, as always, would very much appreciate if you do subscribe. This way you are helping algorithm to support my channel. You're also helping a lot of other people find this content. And I think right now, especially, it's really important to have a really good educational content on gender dysphoria. So would very much appreciate your subscription. And if you don't yet follow me on Instagram, link is below. Please also do so. I am trying very hard to grow my Instagram, and I'm also there showing up daily, encouraging, supporting, offering tips and guidance to all of you. It's a great place to connect with me, so I'd very much appreciate your support too if you can follow me on Instagram. Having said that, for today's video, let's dive deep and discuss and unpack whether those of you who are struggling with gender dysphoria, can actually live with gender dysphoria long term. By long term, I am implying pretty much live with gender dysphoria for the rest of your life, for the rest of your days. Is that even a possibility? What may affect that possibility? What are some of the things most important to understand about gender dysphoria and the potential of living it long term? I want to share with you all of it because I feel that, well, for starters, gender dysphoria in of itself is a very complex phenomenon. It's not as simple and reductionistic as it is laid out in diagnostic and statistical manual. Um, it's much more nuanced. It's much more person-centric. And I think more than anything, what makes it so incredibly complex as a psychological distress phenomenon is that it not only varies from individual to individual, but, and we're going to dive into it deeper today, but it's also tends to, throughout one's lifespan, shift and change and almost think about it as a living organism. It tends to either expand or shrink. As it expands, it may cause a certain amount of pain, sometimes more so, sometimes less so. As it shrinks, it tends to minimize in pain, and that type of unpredictability is what makes gender dysphoria incredibly complex to understand and to treat. So let's unpack all of this today. I'm unpacking this primarily because so many adults, especially older adults, have been reaching out, particularly in, I would say, this year, 2025. Not surprising why, right? A lot of you know I don't have to go into the politics of today. Reaching out to me, inquiring and asking, how can I live with it long term? Because not only am I not ready to step into transition, but also I don't think transition is right now in this particular environment maybe something that I feel comfortable stepping into. And what can I do to cope with this long term? So let's talk about all of this. Let's start with this. Does gender dysphoria ever completely goes away? In my clinical experience, gender dysphoria that stems from gender identity root issue in adults, especially for those who are and have experienced gender dysphoria since childhood, in my experience, does not go away. What happens with gender dysphoria in adults is that gender dysphoria tends to fluctuate drastically throughout one's life and throughout one's overall development. It fluctuates in severity. It can fluctuate from sometimes you experience it very mildly or uh, almost neutral-like to very severe, where it is causing a lot of distress. The fluctuation, the way gender dysphoria jumps around on a scale of pain point is one of the biggest characteristics of gender dysphoria that is responsible for a lot of adults feeling like they're experiencing ongoing gaslighting of what they feel. It's also one of the most important characteristic that is responsible for adults sinking into denial. Why? When you are experiencing a pain point that goes from pretty neutral, you know that there's something there that bothers you, for a whole week or a month, to then the following week or a month, that pain point is at a halt hand, and you feel completely unable to focus on your work. You feel unable to focus on your loved ones. You feel incredible discomfort in relationship to your body. You maybe even starting to dissociate as a result of it. And then again, months, for the whole month, then it vanishes. And suddenly you're not feeling any of it. This type of fluctuation, this type of up and down of pain point is what makes individual, and reasonably so, understandably so, to start feeling and thinking that what they experience is transient, meaning what they experience is going to go away. It is temporary. Because if I have experienced gender dysphoria being absent for a whole month, maybe there is a possibility that then I will experience lack of gender dysphoria for a year. And if I don't experience it for a year, what if there's possibility it will one day just go away? Almost every adult I worked with wants to avoid gender transition. This is understandable once adults, in my experience, have a full realistic expectations and understanding of what gender transition entails. As a result, it's reasonable that a lot of you do hope and desire for dysphoria just to vanish. This hope and desire for dysphoria to vanish, and this not wanting to transition because of all the elements you understand present in transition that make it very challenging, this yo-yoing between the two is what creates a juxtaposition where for very long term you continue to live and grapple with dysphoria, again hoping that it's going to go away. But dysphoria doesn't go away in my experience. It does shift, like I said, it fluctuates. Here's very frustrating thing about dysphoria, and believe me when I say frustrating, it is so frustrating for me as a clinician and as a psychologist who specializes only in dysphoria. It's even more frustrating for me that I, with all of my years of experience, can't put my finger on it. It is the fact that there's no way to find out whether for each individual, depending on their typology, personality structures, coping mechanism, tendency to deal with dysphoria, their current distress signals, there's no way to know for sure whether your dysphoria, as you continue to cope with it, will start getting a little bit more manageable. This is $1 million question everybody asks me. Can I just manage it for the rest of my life? There's no crystal ball. There's no. If any of you have ever worked with me in unpacking this question, you know that I always tell you that there is no guarantee. Usually, what I lay out for people is multiple scenarios. Scenario 1, 2, 3, or 4, depending on their context, their situation, their pain points. So at least you know what might happen. And it's this particular aspect, not being able to predict whether dysphoria with time, with age, with coping, whether it's going to shrink in its pain point, that makes it very, very challenging. On top of that, not only does dysphoria pain point fluctuates drastically and fluctuates for numerous reasons. That's another frustrating part. You would think that logically dysphoria pain point would fluctuate when one is in contact with aspects of oneself they desire. For example, assigned male at birth or is not comfortable with their gender, experiences gender envy when they come into any kind of contact or visual experience when they see a woman out there. The gender envy is going to trigger dysphoria, right? It's almost like a domino effect. Dysphoria is a set domino, ongoing set of domino trails inside of you. And there's certain experiences that trigger the domino, and the domino then unfolds, and then you feel the distress. Well, some things are a little bit easier to predict. If you continuously, every time you run into, using the example of assigned male at birth, if you continuously run into experience of seeing women and feeling envy and your dysphoria increases, that is pretty predictable factor for you that that's your triggering effect. So if you want to cope with it long term, one goal is to find a way to manage when that happens. But the sad thing is, there's so many unpredictable factors that may trigger dysphoria, and a lot of them are even unknown to you. It could be, it could be nothing. It could be out of the blue. You woke up and you feel tremendous amount of dysphoria. It could be you're super hyper focused at work, and then suddenly the dysphoric thoughts pop into your head space, or suddenly you feel the effects of that inability to focus, the brain fog that some of the people experience with dysphoria. That's the challenging thing, is that the triggering effects, what tends to trigger the distress, are sometimes can be predictable, but oftentimes are not. Oftentimes it can just come out of the blue, and it could be even things that may not even altogether be always gender related. That's what makes it so difficult. To complicate it even more, if so, let's put it this way. Gender dysphoria is a distress, right? It's a psychological distress you feel. This distress gets triggered by, as I already said, by numerous elements. Some of them gender specific, some of them are not. When it gets triggered, the distress you experience will vary based on you as an individual. The distress is going to vary based on relationship you have to your gender, or the origin of gender dysphoria for you, your coping mechanisms, your defense mechanism, your typology as a person, many, many things. As I always say in my other videos, if you are anxiety prone individual, the distress is going to trigger, and it's going to also make you cope with it differently than somebody who is depressive personality versus somebody who is neurotic. Everybody's going to cope with it different. And so not only is how you're going to cope with it is going to drastically different, but also your relationship to it is going to be deeply individualistic. And so not only are there these triggering elements, right? But also here's another thing. Depending on where you're at in your life, if you are currently find yourself in a life where you are very stressed, very overwhelmed, due to other factors in your life. Maybe you're stressed and overwhelmed because your loved one is going through some kind of illness and your primary caretaker. That stress is also going to have an effect now. And when the domino is going to fall, how you're going to experience and how you're going to deal with the stress. It's just like anything in our life. We don't exist in a vacuum. Everything is very everything is almost, I'm thinking of the word holistic, wholesome. Think about it that way. But everything is very interconnected. That's the word I'm looking for. Everything is deeply interconnected. And one element in your life is going to affect other elements in your life. This is why I often tell people who are struggling with gender dysphoria, who feels that gender transition is something they do not want, or something that they do want, but they're completely unable to do it due to health reasons, financial reasons, or it's something they don't feel worth it at their life. In other words, if you're watching this and you're trying to figure out how to cope with gender dysphoria long term, not only should you be thinking about how to manage it the best you can and the healthiest way you can, but you also need to consider other elements in your life because everything affects everything in your life. Dysphoria is, if you're experiencing dysphoria, it's an element of distress. If your life and things that affect your life is a whole pizza pie, dysphoria is going to be a slice of the pizza pie. And if you're feeling distress in this slice of the pizza pie, you gender dysphoria. And then that next pizza pie slice next to it is you also stressed about finances because your finances are not in order. And the next slice is you stressed about, um, again, your caregiver in your primary one is going through the health issue, or the next pizza slice pie is you stressed about current administration, whatever it is, the more stressors you have. In other words, the more other areas of your life are in an area of disbalance or tremendous amount of overwhelm, the more it's going to affect this. Same thing with this. The more this is completely blown out of proportion and you can't even manage this for it at all, it's going to affect other pieces of your life, even if those pieces already are in order. If you have a lot of gender dysphoria and it's very severe, your finances are in order, your life, you're happy and successful, your marriage is wonderful, your kids are great. This is still going to affect the rest of it because, again, you don't exist in a vacuum. Everything is deeply interconnected. So when people ask me, can I live with gender dysphoria long term? It's a multi-million dollar equation. Does dysphoria ever goes away? My experience, no. What happens is that dysphoria doesn't go away, it shifts. It's almost like um, uh, the image that I get when I think about gender dysphoria is I think about it as almost this object that maybe even like a sponge that when you maybe sponge is not a good way, but it's an object in my headspace that has capacity to shrink, to expand and occupy a lot of space. It also has capacity to fragment and break into pieces and go into different elements. It's just one of those uh, it's one of those really frustrating, incredibly elusive, um, elusive um, psychological distressors that are so difficult to really put your finger on it. And the reason why it is so elusive, again, is because everybody's so different, right? Um, my psychological distress is going to be different than yours. Somebody else's psychological distress is going to be different too. And all of it is going to revolve around so many of your own lived experiences, circumstances, um, your own experiences. And that's why there's no one way to really define and no one way to treat gender dysphoria. Hopefully, unpacking it today, and I know this is not an easy way to unpack, and I know there's a lot to digest there, and I know that even today, in trying to describe it to all of you, I probably haven't even fully been able to elaborate on the complexities that is gender dysphoria, but it is incredibly complex. So when you as adults are looking for a way to cope with it, can you cope with it long term? Look, yes, people have been coping with gender dysphoria for centuries, for as long as human beings existed. We're not the first human beings on a planet experiencing gender dysphoria. And coping was also um, revolved around the context of time. When people did not think that there was any treatment for gender dysphoria, you know what, to be honest, it's a little bit easier to accept there's no treatment and you just have to kind of deal with it psychologically as the best you can. Today, we live in a world where we're inundated by social media and we're inundated by content and people talking about their transitional timelines. So, for a lot of you, you know that there is an outlet there. For a lot of you, also, the outlet is not an option. And this knowing that it's out there, but at the same time, knowing it's not an option, additionally adds another layer of complexity. But yes, people have and continue to cope with it. The best that I can offer all of you is that if you are coping with gender dysphoria and you're planning to cope with it long term for the rest of your life, which is again, it's everybody has to figure out what's best for them. The best you can do is find out, try to pay attention if you can recognize any triggers. If you recognize triggers, and if there's a pattern to when they occur, in the very least now you have a higher potential of controlling those particular triggers versus when dysphoria spontaneously out of the blue pops up and there's no way for you to control it. Then pay attention to when your dysphoria does get triggered and you do feel discomfort. What are you doing to alleviate it? Is technique you're using to alleviate dysphoria is adaptive or maladaptive? Adaptive, healthier, something that's sustainable long term. Example, you feel dysphoria, you go for a run. That's an adaptive technique. Physical activity is wonderful. It's good for you, it's good for your health. You feel dysphoria, you drink a whole bottle of wine, is maladaptive. That wine now trickles down and sets another domino down rabbit hole of your health now suffering, and now you're adding additional potential struggle and pain point into your life. So this is one way you can pay attention to. What are your coping styles? Are they simply put good, or are they bad coping styles? You also need to be prepared and to understand that there's no guarantee. Dysphoria may, as you get older, may kind of, it's almost like a balloon may kind of lose um, its rigid form and structure, and as a result, it may not cause so much pain. On the other hand, for some people, it might not. And so, living with dysphoria long term and coping for the rest of your life, you have to also accept and to acknowledge that it puts you in a state of constant unknown. Um, this is, if I think about it, no different than some other things. People are living in a constant state of unknown. And I think that's another thing we also need to normalize in gender affirming care is that it's not the end of the world if you're living in a state of the unknown. And for you, unknown would be, will dysphoria get more severe? Will it get to the point where I can't even live without it? I am, as a lot of you know, a cancer survivor. I had cancer when I was 16 years old. I'm still living in a state of unknown because even though the type of cancer I had is not going to come back, my doctors surprised me with the news that I may get leukemia because of the severity of chemotherapy that I got to treat my cancer. So I'm living in that state of unknown, right? There's no guarantee. We're constantly living in a state of unknown in a sense of we don't know if we're going to go to sleep and not going to wake up. When we get in a car, we may or may not get in a car accident. Earthquake might happen. I live in California. Has been lots of earthquakes lately. There has been crazy wildfires. A lot of people lost their homes. In other words, we have to also acknowledge and accept that life revolves around uncertainty. And so if you're going to decide to live gender dysphoria long term, try not to wear it as a head sentence, um, but try to accept and acknowledge an element that there's going to be an uncertainty, and you'll cross that bridge when that's going to happen. So the worst you can do is live in a constant fear that it's going to come back, it's going to come back, it's going to come back. I'm going to wake up and it's going to be so bad. It's going to put me in a position where I'm going to have to come out and I'm going to lose my loved ones. That state of ongoing existential anxiety and dread and catastrophizing is increasing the stress, the exact amount of stress that is actually going to trigger dysphoric responses, that is going to actually trigger you feeling worse when dysphoria hits. So the best you can do is if you again make a decision that I'm going to live with it and cope with it, acknowledge, accept it, pay attention to your coping mechanisms and do the best you can. Will dysphoria completely go away? I doubt it. If it went away for you, congratulations. You're the first case that I've seen where it completely went away just by sheer force of living with it. In my experience, it either tends to just completely minimize for a lot of people, it tends to do the opposite, exponentially increase for a lot of people as they get older. And for some people, it just kind of tends to yo-yoing and stay the same, fluctuating drastically up and down, up and down. But it varies for everybody very different. Nobody's going to have a crystal ball to tell you what's going to happen. There's no way of knowing. I wish there was a way of knowing, but we don't know yet. So comment below, let me know where are you at with dysphoria? What are your thoughts? Have you decided to cope with it long term? What are your coping mechanisms? How do you manage it? share if you can how old you are, if you've been managing it, what happened to dysphoria, what has been the nature of your dysphoria. Comment below. Love reading all of your comments, and I will see you all next time. Goodbye.